Thank you and good afternoon to everybody. And at the outset, I would like to thank the DST, the seed division, for funding this project. And I also would like to thank our collaborators, Professor Bihari Singh and Professor Rajesh Kumar from the Center for Fluorosis Research in the AN College of Patna. So, with that, I would like to give a brief introduction to the work that we have been doing in various districts of Patna in conducting the research and also helping the scheduled caste communities in those fluorosis endemic areas of Patna. So this the title of our project, as Dr. Manisha has already read out, is the Fluorosis Mitigation in Scheduled Caste Community of Bihar through intervention and counseling. So initially we started off this project as a fluorosis survey and data collection. And in the initial phases, when we went to the field, we have seen that the scheduled caste communities were living in very poor socio-economic conditions, and the drinking water that they were consuming was heavily contaminated with fluoride, and there were a lot of skeletal and neurological deformities and all those things which have been resulting from hundreds or if not thousands of years of consumption of this contaminated water. And the villagers were very reluctant to cooperate with us, and they did not want to let us into our homes or share any data, because they have been complaining that a lot of teams have gone and they have collected data, taken photos, and have gone back and done nothing. So at that stage we came back, and then we thought that the research that we are going to conduct in the community should not only benefit us uh, by way of collecting data and getting publications, and we thought that we should also help during the process of our research. We have to help the communities in some way, so that they also feel like partners in the project. So at that stage we approached the Department of Science and Technology to fund uh, the the filters that we wanted to install in the field. And that was a challenge, to find filters which do not require any electricity and which can be used on the existing hand pumps. And luckily for us, we have got a particular manufacturer from Nagpur, and who could supply us such filters at uh, very competitive prices. So we have installed those filters in about 12 villages of some districts of Bihar. So, in fact, we already collected the pre-intervention data, and we have seen that so many, hematological, that is anemia, malnutrition, and neurological deficiencies, and skeletal and dental fluorosis were rampant in those communities, and the communities were actually believing that it was a curse of the god and that nothing can help them. So, from that particular kind of belief and superstition that it was the curse, then we could convince those people that the water that they are consuming is the culprit, and if we can replace the water, contaminated water, with fluoride free water, then these all these problems that they have been suffering from generations could be resolved. So as soon as we started this intervention, and they started feeling the benefits, and they started feeling the improvement in their health, and lessening of the pain that they have been suffering, and the and because of the pain and these deformities, they were not even able to perform their occupations properly. So after some intervention, and most of them got convinced that it is the water, safe drinking water, that is required to alleviate all their problems. And they started volunteering themselves, and then along with that we have also started giving advice on food, that is editing the nutrition diet. And also we started giving the antioxidants and multivitamins and the supportive treatment and all those things. Actually, the details of this particular project will be shared by Dr. Javed, who has been actively in implementing this whole project. So if you can allow me, Dr. Rajesh Kumar and Dr. Bihari Singh have been of great help to us, and they have provided their teams. And sir, both of you, we are very grateful. Sitting in Delhi, otherwise we wouldn't have been able to implement this project so successfully.
Yeah, good afternoon, ma'am, and all the respected members.
Good afternoon, sir.
Actually, this is introduction about the project and research engagement here in AIMS. We have, as sir has explained, we can see that here how pathetic condition is there in the community, that is SC community, and all those people here. You can see that there are skeletal deformity even in child and in adult, in old age person. You can see this person, he was not able to even get up from the cart, that is from the bed. And now with the intervention and our counseling treatment through the telemedicine, as well as the expert opinion from the our clinicians, now he is able to walk, and most likely within 2 to 3 months they will be able to walk also. So these are the few pictures here. You can see the deformity in this case is completely. So we can't revert them to the normal condition, but here we can see that in childhood condition we can revert them to the normal, and they will be able to walk. Even apart from the skeletal deformities, in initial stage, the woman and the person in 30s to 40s, they were not able to work properly, and they are working for 2 to 3 days in a week, and sometimes it is difficult to go for work because of the severe pain they have in the joint and the muscle. So after our intervention, they have started working. Now they are realizing that they are able to work, and especially the children, they are doing well. Their skeletal deformities are getting corrected gradually, but this is the disease which cannot be reverted completely to the normal condition. But yes, gradually we are trying, and we are able to correct the deformities for the certain significant percentage. And the female, they were not able to work because of the pain and the restricted movement of their joints. They were generally working in bhatta or crop field. So, and there they need to lift the stuff, and they work hard, and their health condition were not allowed to do so. But after our intervention, safe drinking water, medicines, and advice from our expert team of the AIMS New Delhi under the chairmanship of Professor A. Sharif, now they are able to go for their work, and they are not only improving their health condition, they are also improving their livelihood also, because they are now able to earn more and more. And all those journey, as sir has explained, that Professor Bihari Singh and his team, Professor Rajesh Kumar in his team, and the active community members of the committee, even the Panchayati Raj person, that ASHA workers and local
Doctors from
primary health centers, they are helping a lot, and they all are on the board in the journey of this social work, socio-scientific work.
And one of our project staff, Jayant Kumar, is also permanently resident in those areas.
Yeah,
in the field.
Jayant Kumar, one of our research assistant, he is posted in the field by Professor A. Sharif sir, and continuously he is doing the job there.
So he is monitoring the patients, and he is also looking after the maintenance of all the filters that have been installed in the field. And the filters are very efficient, and they are working very well. Right? Even 10 ppm of the fluoride is actually filtered out, and I think that the water is consistently giving 0.05 ppm. ppm.
So for the installation, choosing the research area and that filter installation, first we survey the area and see here the fluorosis is like, here the groundwater is contaminated with fluoride, and fluorosis is up to 10 to 15 ppm in the groundwater. Even it should be better if it is 0.5. So, and here you can see, first we identify the severity in the area, and then we used to give them counseling, and then convince them to join our team, and then we used to install the drinking water. During the period, we have also tested the various sources of water, and where we cannot install filter, we give them an opportunity to drink and cook the food from a safe from the water like collected from the safe drinking water sources.
In the areas where we were not able to install filters, we identified the safer sources of water, and we have put a green tick on that. And then the where the sources of water are more heavily contaminated, we put a red cross, and we advise the people not to drink water from the sources that are marked with a red cross.
Yeah, so these are the certain severe cases what we have seen. So this is the progress what we have made in the first year objective wise. So these are the villages which we have covered, and the more. So these are the actually area where with the longitude and latitude everything is with the beneficiary mobile having the mobile number facility. So some community members, they are giving their number, and this is the level of fluoride. Here we can see that if we discuss about the Shekhpura, here we can, this is the
complete geotagged data is available. Geotagging of the water sources as well as the beneficiaries and the geolocation.
water is 9.934, 5, 7, 10, 3, 10, 6, 5. So these all are alarming and very dangerous for the people. So the same we are continuing, and then the achievement what we have made now, and during the COVID also, because the project, when we started this project, there were severe COVID disruption due to this unprecedented pandemic. And during the period, our project was helpful. Our people were helpful to provide counseling, guidance, and we have given with the help of Contact, one of the initiative of AIMS under the supervision of Professor A. Sharif sir, and it was also and with the involvement of Minister of Health and Family Welfare Director AIMS. So we were able to provide them the advice for
healthcare advice regarding the pandemic as well as any other healthcare problems that they are facing. So we could provide them teleconsultations and remote help actually. And our project work also has gone on uninterrupted. Again, once again, thanks to Professor Bihari Singh and Dr. Rajesh Kumar. Their teams have worked relentlessly even during COVID period in the field, and they have ensured that our project work was going on and all our filters have been functioning well. So thank you, sir, once again, both of you.
So, and apart from that, we are providing the medications also, and those medications are advised by our expert team who are here co-investigators in the project, and also we invite other expert and super specialists based on the need in the field, and as per their recommendation, we provide medicines. So as sir has explained that initially they were very reluctant to take the medicines, and sometimes they used to give the medicine to their goat bakri and then gradually
we had to bribe them even to take medicines.
yeah and we organize a small party kind of thing with good food and all, and then gradually they have realized that they will be now they are getting
now they demand
for all
they're
those
demanding
things.
medicines, and they're demanding antioxidants. And the villages where the filters are not installed, they come and demand. So, but unfortunately, we are only a research project, and we are not a waterworks department where we can go and install filters all over the place.
Yeah. So during the COVID interruption and maintaining all the COVID guidelines here, we can see that during the period we have been continuing the research work, and they are taking these medicines, and even we follow up the through phones that whether they are taking that safe water what we are giving as a medicine, and they are taking the proper medication as advised by our expert team, and doses and how many times a day they have to take, and everything we make sure from AIMS with the help of teleconsultation and telemedicine. As
you can see Dr. Javed and Dr. Sabha, who is a scientist in this particular project. They go very frequently to the field, and they keep monitoring and collecting data and the samples directly. And we also prepared a mobile lab where the samples can be analyzed then and there in the field itself. Again, it's all part of the project, and again, thanks to the DST for making this possible.